foot. So yeah, sort of a goofy looking foot here. This will be the foot coming down. So I've got this foot basically is like a foot for reflexology. So the important things you need to know is like the tips are really important, especially this time of the year, because those are the sinuses. So if you want to work the tips of the toes, you can help a person with their sinus issues. Yeah, great, isn't it? The eyes are basically on the underside of the foot, so let's draw the underside. You can just imagine, here's the underside of the foot. So the eyes are going to be, let me get a different color here. The eyes are going to be in this area, like right in here, so that's the eyes. So people have eye issues, you can massage right on underneath the foot. Let's see some other things that are important. That you guys would sort of be able to, yeah, maybe on the baby toe, this area here, it might be a good one. This is the shoulder area. A lot of people have shoulder issues, so that might be an interesting one. This would be on the top, so this is the bottom of the foot. Let's put bottom. And this is the top, okay, dorsal area. So this is the eye, and the next one, this is the ear, and this one next to it would be the eye. So these two toes right there. Hip joint might be a good one that you guys want to fool around with. So let's draw a simple malleolus right here. That's the bone in the ankle, right? So this would be the medial side. So this would be the hip. So this is on the medial side. And the other one, let's draw the lateral side of it. That's really a crazy foot, huh? So here's the malleolus. Yeah, pretty funny. The rectum and the anus. So this again is the medial side. This is the hip. The rectum and the anus are right in this area. So this is rectum and anus. So somebody's got a prolapse. I have a patient who has a prolapsed anus. So it's difficult for them to defecate because the rectum is just prolapsed. It's like collapsed basically. And doesn't have its muscular strength anymore. This is where you want to stimulate. So by the Achilles tendon, get on the medial side. On the opposite side, here is the hip joint also. So that's the lateral side. This is lateral. So there's the hip again on there. Yeah, and along the lateral side on the outside, this is right in this area. You don't have to be super accurate, but you want to be in the general area. There's the elbow, and here's the knee. So these are areas you can massage with a tool. Obviously, it's much better to use a tool. This is for gua sha, but you can use this part of the spoon to dig in there and to do some small stimulation in the area. But be careful. You don't want to press too hard with these because they're ceramic and they can break. And if they break, you can obviously spear the patient, so you got to be careful. So if you're going to do deeper work, for gua sha, that's for scraping. If you want to scrape here, you're fine. But I would get something like this. So this would be a piece of bone. So you can still do the scraping, and then if you wanted to, it fits into the hand really nice. You can go ahead and just do stimulation in that area, on the specific area that you want to do. So some simple ones. Tips of the toes, sinuses, right? The eyes are going to be at the base of the toes. This is on the bottom of the foot. So this is the plantar area. This is the dorsal area, the top. Shoulder is going to be a little bit off to the baby toe. So you can see, here's our baby toe here. So this would be shoulder area. So it makes sense, right? If you're working on the foot, shoulder, elbow, knee, right? Be pretty good. Okay, let me see if there's anything else. Yeah, I mean, the bottom, so for people with asthma, let's do something with asthma. So let's do right in this area. It's going to be long. So you want to work that area. So you can treat it in a couple different ways. You can get a tool with a point on it and obviously stimulating there, or you could go ahead and scrape it lightly or do some really strong gua sha in that area. But even a nice pointed tool, you can get into that area and just do some, you could use that in this too. It's a little bit thin. You want more of like a rounded point to get in there. So that's a lung area. Yeah, I mean, maybe two things that you'll see sometimes in practice. So let's do a different color. We'll do thyroid. Many people in America have thyroid due to the fact that there's a lot of chemicals in our environment that mimic iodine. Like fluoride mimics iodine. So we have a lot of fluoride in our water, a lot of fluoride in our toothpaste. So that fills up the iodine receptors in the thyroid, and people have a hypothyroid kind of presentation. Even though they don't really have hypothyroid, they have the receptor sites for the iodine filled with fluoride and other chemicals. That there's a few others that just don't come to my mind right now. But this area right in here would be the heart. So thyroid, heart, and they have a close connection. You know, if obviously your thyroid levels are down, your heart rate's going to be slower, metabolism can be slower, you can gain weight, gain water, be really exhausted all the time, muddled thinking, hair falling out is a big sign of hypothyroid. Hair getting really brittle, maybe more so than falling out. First it gets really brittle. It sort of gets sparse. You've seen women like this with really sparse, brittle hair, and that's a underactive thyroid, and they're, it's not being taken care of. So skin real dry. People have, skin diseases, rashes. Let me see if there's anything else that you guys might. Yeah, on the heel, down here, this area right here, they call it for the sex glands. So that would be both glands for both male and female. So right in there. And also, one that's not on this one, but it's on a lot of different charts. This area right here where the line is would be for sciatica. And this works really well. I came back from China and I did this on my mom. I just used something like this, a pen cap lid. I didn't really have any tools with me, and I just would sit her in bed at night. I think I used some warm towels on her feet, made her feel nice and relaxed. She laid on the bed, and I just sat there and held her foot under my thigh and just scraped on that. And 3 treatments and her sciatica was cured. And she was suffering for a couple of years. I was in China for about 4 years straight. I didn't come home. And her doctors were, giving her pills and drugs and telling her to take ibuprofen. And I had 3 treatments and her sciatica went completely away. So. Same with her hearing. She's had some severe hearing loss in one ear and a little bit in the other. I did ear candling, but a lot of candles. I probably did 10 on one side, maybe 8 on the other. She was real patient with me. I just kept candling, and because we kept testing, how do you hear? And after about once I did the 10th candle, she got up and she said, "Oh my God, it's like I got a brand new pair of ears. I can actually hear everything now." Wow. It was really amazing. So, obviously, I did a lavage, I did some hydrogen peroxide and stuff, she had some wax come out. But basically, I think it was just old wax in there, and, possibly maybe she had some mites, or some kind of small, bacteria or something, and the smoke killed all that stuff. And it might have been irritating but as the days progressed, 2, 3, 4 days, her hearing got better and better, almost to the point where she said it was like when she was younger. So, for her, that was just amazing. So that's when she got convinced that this medicine was, much better than, she suffered from constipation for years, and I put her on some good vitamins and gave her some herbs to take and got her off dairy, and she started to have regular bowel movements. And from that time that I did that till the time she died, she never had problems with her bowel movements anymore. Wow. So, yeah, I mean, for some people that are fairly healthy, just simple things can bring them back to health where the doctors have no clue and they just experiment on the patient. Probably, I think that's good enough. I mean, I don't want to overwhelm you guys with a lot of different things. The descending colon maybe you want to do. So here's our ascending colon here, and there's a descending. But this is probably more functional. So the descending colon, let me draw a line from there. So we had, let's see, the rectum and anus up here, right? And then, so this is the descending colon. So if you did both the Achilles tendon on the lateral side, because this is the lateral, I'm sorry, this is medial side, so you do the Achilles area, and then you go on the plantar side, the bottom of the foot, and you go ahead and work this area. You can help people with constipation. And it's very effective. Very effective, all footwork is. But here's some of the tools that I use on feet. So obviously, cow's horn, you can use for scraping. You can use it for pressure. These are nice, the stars made by Massage Star. So they got nice points. So these, you can see, and then this is for like tapping. They got this for scraping. So it's pretty smooth. You get the edge in there. You can do some work in there. It's a little bit bigger version of the Massage Star.
What do you use the brush for?
Brushing is for, you teach your patient, it's for lymph drainage. So people are really toxic in their legs feel poisonous and heavy. You just buy one of these natural brushes. You can get them at any hardware store. They're about 98 cents, $1 maybe a piece. And what you do is you tell your patient to sit in the morning when they're naked before a shower, and they brush up towards their center, towards the chest. You just brush really gently, sort of tickly, and it stimulates the lymph. And they brush down the arms, obviously, because you want to go towards center. Brush down the arms, brush the neck, brush the face lightly. And you do it with a dry body, and then you go take a shower. And a lot of toxins come out of the body. A lot of times after the shower, you want to urinate or go to the bathroom. And they call this dry brushing. This is an old ancient remedy. I know Egyptians, they got it in their literature and some other cultures. So you just buy, this is a loofah. So it's a natural brush. That's the best to get, they say. And, similar to that, but not a brush, would be this. This is the, I think it's called Lapcoat. It's from Ukraine. So it's got a bunch of needles on there. And the needles are nickel and iron, I think, steel. And it produces an electrical charge. And so you rub that on the body. So on the feet, you would rub it on the bottom, which is sort of ticklish on some people, or on the top. And you're basically stimulating all these points. So these different areas of the body, you can focus. And it could be a little bit painful for some people, but you want to take your time. So if a person's having a lot of pain, you just lighten up on it a little bit. If you can go a little bit more deep, and obviously you would focus on what area of the body that's giving you. This is really good for sinuses, because it goes, just take the tips and just rub it on the tips. And it feels a little bit painful. It's not horribly painful, it's just weird kind of painful. And you get that on the tips, and it stimulates the tips of my sinuses. So I can feel myself draining right now. We talked about, my allergies today.
Yeah.
So I can feel things starting to get draining and starting to sort of dry up a little bit. So this one hurts really bad. So usually when pain is elicited when you do this, it's often a sign that there's a problem in the area. There's stagnation. So obviously there might be a little discomfort, but if it's really painful, like some people have really painful feet, that's the kind of person we want to work on, because they're going to benefit tremendously. Another one that we got is the therapist thumb. So this is probably one of the better tools. So it just perfectly fits. It's plastic molded. The thumb is protected. You can get into these different points. You can use the edge here, right here, to do scraping. You can do this, where the hand grommets are. You can go ahead and do that for stimulation of the foot. Like you can stimulate the sciatic point, or any of these points, the lung, the sinuses. So it's it's a multi-purpose tool. It's pretty cool. Yeah. So I'd recommend, if you're watching this video, that you would buy they call it Thumb Saver here. It's a different company. The original was the therapist thumb, invented by some massage therapists. So if you can get one of these, they're like $12 to $15. So it's a really good quality product. And you can't work on feet without one of these. I see people do. I've seen reflexologists where their thumb is already, displaced back like about half an inch or so from doing all the years of pressing into people. Is some people believe you got to use your own hands. You can't use tools, and that's just insanity. If you're going to work on a lot of people, you don't want to destroy yourself. Plus, you want to be able to have, and what's interesting is that after a while, you can actually feel more through the plastic or steel or whatever you're using because it vibrates, whereas our hands are padded, so vibration is cut down tremendously. But through this, the different textures underneath the skin, the bone or adhesions or whatever it happens to be, an inflamed area, you can actually feel better with plastic. But it takes some getting used to because it's different from what you've been used to using the thumb. But eventually, using something like this, I can actually see underneath the skin better because I'm not using my pad on my thumb anymore. So my pad is actually using all of its senses. There's millions of sense organs in the thumb. It's actually reading what's going on right here. So that's perfect. Then the last one I've got is one of these little sparky guys, AccuSpark sometimes they call them. But they're a different company, different brands. This is I think was made by a guy, he manufactured it by himself in his own garage. But you put that right on the point or wherever. So let's put it on, this is the sex gland, and we'll hit that, and we spark it. It actually gives a small, it feels just like a static electric charge in the wintertime when you touch the doorknob or something. Basically feels like that. So you hit that point.
Is that the same thing chiropractors use?
I think so.
To adjust?
I think so. No. That's a different one. That's an activator.
Oh.
That's different. That's actually to move bone tissue.
Yeah.
So that the bone tissue moves rapidly and you break up adhesions, you break up some stenotic tissue, like maybe bone growing to bone.
Very similar though, right? Is it
That has no electricity in it at all.
Oh.
That's a spring.
It's like this, yeah.
This is a piezoelectric. There's actually a coil in here,
Oh.
and when I press on this, it actually moves through the coil and fires through a quartz crystal. It fires a charge. So you gotta feel it. So this is different from the activator. So you can actually feel the electricity. Now, if you ground it, it's much better. So like if I do it on myself and I ground it, I can actually feel it. So without this, it's a little bit, I'm actually feeling it more than probably, but if I ground it, then it'll actually penetrate. So, and you can actually spread it. So if I ground it here, I can get the electrical charge to move all the way to the ground, So as I touch it, so I can feel it all the way through there now. Obviously, it's stronger here, and it disseminates as it goes, but it's still, so when I want to move a whole area, I'll put it on the point, and then I'll move my hand to a distal location and hit it. It's disturbing up in here. A lot of people will feel real uncomfortable with it, but I mean, if you have TMD, temporomandibular disorder, and you do it on here, if the person can handle it, and they've got different tips. One tip is a little bit longer, so it doesn't feel as strong. So you can extend the tip. That's the thing, solution. But these are some of the things that I would use to treat the patient. So you got lots of different tools. I think it's important to see the different tools, And these are good to have around because you can show the patient, we'll see these are the points I'm working on, it's because I'm affecting these areas. And they go, oh wow. So I say, oh yeah, see, it's all printed up like that. And they can look at it and say, oh, I have problems with this too. And you say, okay, we'll add that to the treatment. So it gives them a chance to, point out to you, these are my problem areas.
Is there a point for TMJ?
Well, yeah, there's a lot of acupressure points in here. But in here, let's see if they've got, right here would be more for TMJ. You've got upper jaw and lower jaw. So the upper jaw would be right in here, and the lower jaw down here. It's on the big toe. So you can see it right there. There's upper. So right under the toenail is TMD. Remember, TMJ we all have. TMD, not everybody has. That's temporomandibular disorder, right? We all have a TMJ. Even dentists say it wrong.
Yeah, I didn't know that.
Yeah.
Well, what's TMJ?
Temporomandibular joint. We both have both of those, but not everybody has TMD, temporomandibular disorder. Yeah. Of the joint, obviously. So they should call TMDJ, right? Right onto the side here, the big toe is the cervical, and often they say that the side of the foot, inside the foot, the arch, is the cervical area. Then you get the thoracic area, and then you get the lower spine. So this is the lumbar area, and then this is the pelvis down here.
Is it important to do both sides of the feet?
Yeah, I mean if you can. So when I I'll show you sort of what I do to the feet. But after we do some of this, we're going to practice, moving some of the joints and so forth like that, just to try to open up the feet, doing different techniques on the feet. And then, if we have time again tonight, we'll do some Thai massage. That's just a generalized movement of the different tissues. This is more specific. So I want to teach you guys specific work tonight. This is really, a lot of people need help on their feet. I've been amazed at how many times I've really helped people a lot just from, working on their feet. And if you ask people specifically, they'll tell you, oh yeah, I didn't know I should complain about my feet. My feet hurt all the time. They just think it's normal. So talk to them about shoes. Make sure they wear support shoes. If they wear flip-flops all the time, they're going to have trouble. In a normal environment, in a dirt, leaf-covered, stick-covered environment where you're walking on all this ground, you've got some cushioning, and flip-flops would be fine, or bare feet. But people that walk around in bare feet or flip-flops on hard concrete, really bad for the feet. Really, really bad. And a lot of kids do that in the summer. It's cool. They do that. They think it's fun. But then they are really flat shoes in this environment. Horrible. People don't want to look so tall or whatever, so they wear flats. They think it's cool to wear flats with no socks, and their feet look horrible. So it's always good to wear nice supporting shoes with a big toe box, so something that's wide enough. According to statistics, women choose shoes 2 sizes smaller than they're supposed to.
Holy shit.
That's really, really a lot.
Wow.
And that's a national statistic. They've done surveys. 2 sizes smaller, not a half size, but 2 sizes smaller, which means their toes are going to be bunched up in the toe box like that. And also, the smaller the foot, the toe box is going to be smaller, so it's going to crush the feet together. And they say good health means your toes are flat and they're also very spread.
Yeah.
So these kind of toes are toes you see of people that live in the jungle that walk with bare feet. They've got very, very spread toes, and the toes are like this instead of like this. We get all kinds of different problems with our toes.
I have kind of wide feet, so from wearing shoes, like my toes.
Right. And then you see high heels, and this large toe, the first digit, will be all the way over. I've had a woman that it was all the way over to here. It was literally that it was disjointed. So she was completely out of joint.
Wow.
And, she's complaining. And then obviously these 4 toes were on top of each other. They were all wound on top of each other, almost like my ficus tree. It was just amazing. So she had been in a small high-heel toe box for a long, long time to get the toes to do that. So it got to the point where when she put on her high heels, her big toe was actually outside of the toe box. It was sitting there. It was just embarrassing her, so she was going to get surgery. And I said, "Are you going to still wear high heels?" She said, "Of course, I have to for my job." And I'm thinking, what kind of job is that where you have to, But the Playboy Club is closed.